Assalamualaikum warahmatullahi wabarakatuh. My name is Srifia Wardianti. I'm from Syahkuala University. I will begin my serial case presentation about contributing factor that affect wound healing process in post-total laryngectomy patient. For introduction, laryngeal carcinoma is the third most common malignancy in the ENT head and neck department. There has 79 cases of laryngeal carcinoma from 2017 until 2021 in ENT department of Zainal Abidin Hospital. Smoker and alcoholics are the highest risk factor. Well, in patients with post-total laryngectomy, prolonged of wound healing process is one of most common complications. The wound healing phase consists of 4 phases that is overlap respectively. There are hemostasis, inflammation, proliferation, and remodeling phase. And all of factor was impacted by local and systemic factor. In this serial case, there were 7 cases of post-total laryngectomy patient. Each patient was observed and expected to get oral feeding in less than 14 days post-surgery. Case number 1, male, 50 years old. From observation, on the day 11, patient get oral feeding. Case number 2, male, 54 years old. Patient already had malnutrition and get oral feeding on 35 days. Case number 3, male, 54 years old. Patient have anxious, psychological problem and low compliance. 3 days after surgery, we perform emergency surgery of reopen for debridement and bleeding exploration. And then 50 days after second surgery, the patient passed away. In case number 4 and 5, male, 70 and 64 years old, healing phases results show as expected, despite of age issue. Case number 6, male, 66 years old, healing phase as expected, but he passed away because COVID-19, confirmed on 12th day post-surgery. The last case, male, 54 years old, has malnutrition. Until 32 days post-surgery, still not accessible oral feeding. Result of serial case number 1, 4, and 5 is expected. But case number 2 and 7 have similar malnutrition condition. And case number 3 passed away because low compliance due to psychological issue. And we've lost patient number 6 because COVID-19. Oral feeding is recommended after 10-day post-total laryngectomy. Based on Kentel et al., the proliferative phase and collagen matrix formation occur from 5 to 14 days, with the tensile strength of the wound increase progressively. Then Applebaum and Levin state that the wound's weak point was 7 to 10 days after surgery and proposed delaying oral feeding until after that period. Based on Heyer et al. That have double incidence of chronic wounds in the group over 50 years old because they have a thinner epidermis and inflammatory low response. But in this serial case, patient over 50 years old can get oral feeding on day 14. Chronic disease factor induce microangiopathy, and lead to tissue hypoxia that cause delay healing process. However, despite patient number 4 have history of diabetic mellitus, wound healing process achieved on time. Psychological and nutrition factors are important for healing process. Protein is primary component to support cell generation, tissue growth, collagen formation, epidermal growth, and keratinization. In this serial case report, 2 patients that had delayed wound healing due to malnutrition, and one of the case had low compliance and psychological problem. The main factor that affect of post-laryngectomy wound healing process in this case series are nutritional and psychological factor. There is no significant result between age and chronic disease with wound healing process on this case series. Thanks for your attention. Assalamualaikum warahmatullahi wabarakatuh.